This is Dr. Drew Hall with Upper Cervical Healthcare of Los Angeles and Carson. Today what I want to talk about is a case that just came in a couple of weeks ago. It's a little boy, about 2.5 years old, who was born at 25 weeks of age. And that's young, as you know. 36 to 38 is in the general area where a kid is delivered, and being born at that age subjects that individual oftentimes to complications. And to make a long story short, this 2.5-year-old kid was diagnosed with mild cerebral palsy. Now, it's not the typical cerebral palsy where the head is cranked over and the hands are in clonic contraction, but he's 2.5 years old. He has not crawled, he has not walked, he cannot even sit up on his own, so there is a lack of development in the neuromuscular integrity, and there's some speech delay. And so anyway, a really good patient of ours knows the mom or the parents and suggested that he come into the office. Now, with all cases, we don't have all the answers, and many cases come in here with really severe conditions, but we do know one thing. Regardless of what condition someone comes in here with, if this upper cervical spine area, which this is the atlas, it's a 2-ounce bone where your head rests on, and down through that top vertebra and the second vertebra is the spinal cord, more specifically the brain stem. And the brain stem is the automatic seat of control for all the function in your body that you don't really think about. And regardless of what they come in here with, if they have had a spinal misalignment and that top vertebra is locked under the skull and is decreasing nervous system function, no matter what they come in here with, if you correct it, the body is going to function better and it's going to give its best chance to heal, mend, and repair. So in this particular little boy's case, we ran him through all of our objective indicators and we found that his C1 vertebra was off, and we put him on his side on our table. And with little kids, we adjust with our middle finger right on the transverse process of the atlas. Now, little kids, their bones are cartilaginous. The joints are still cartilaginous, and they're not really cup shaped, so there's a lot of freedom of movement in there. And what I'm getting at is they're quite easy to fix. And so anyway, we have this little boy on the table, and we get him corrected. And I sat him up off the table and let go of him, and about 2 seconds after he was corrected, the mom started sobbing, and I'm like, oh my God, what do we do, right? But I had forgotten in consultation that she told me he couldn't sit up, and so I took my hands off of him, and she started crying, and she mumbled about 5 seconds later, Dr. Hall, you realize he's never been able to sit up. And so that wasn't what I was expecting to happen right away, but it does show you the power of this upper cervical spine. Now, it's been about 2 weeks with this kid, and the clonic contracted muscles in his legs have reduced, his speech has increased, he's crawling now, he's able to sit up on his own, and it's been 2 weeks. We don't know if there's going to be a complete and total resolution of the case, but we do know that keeping this area clear, and we've already seen great progress happen in this individual, and we expect it to continue, but none of us have a crystal ball. We don't know where it's going to end up. But we do know, if we keep the upper cervical spine clear of the nerve pressure, no matter whether they're 2 years old, 10 years old, or 90 years old, you're giving that person's central nervous system its best ability to function properly. And in the case of little kids, they have a huge capacity to heal and repair, and they generally make upper cervical doctors look good because they respond quite rapidly. So hopefully here soon we will have a testimony video of the mom telling the story of this little boy's recovery. But I did want to put this video out there because I know there's lots of kids that suffer with all sorts of different conditions, many of which there's nothing really that can be done in mainstream medicine, and being able to look outside of one paradigm of healthcare into a natural healing paradigm of healthcare sometimes has some answers that can help these little kids function better and become as normal as possible. So if you're listening and you have a child that is dealing with a chronic problem, whether it's cerebral palsy, speech delay, they are missing milestones in neural development. Many of these children do very well when their upper cervical spine is corrected. So we have 2 offices in the Los Angeles area. If you're interested in a free consultation, we offer one. Our Carson office number is 310-324-6172, and our Los Angeles location is 213-399-7772. If you're outside the LA area, you've come across this video on YouTube and it's piqued your interest, you can call either one of those numbers. Our office staff would be happy to find you a upper cervical doc that is qualified in your area. So I hope this video was informational, and it's always great to see little kids' quality of life improve, and I'm looking forward hopefully to the day where this kid has become a normal little boy walking around and developing the way that he's supposed to. So thanks for listening.